much for being here. Welcome to the Campus for Jewish Living. My name is Stacy Lewis. I'm our Chief Development Officer, and I'm delighted to see many familiar faces and also some new ones here today, so thank you. I want to begin by briefly introducing the organization for those of you who haven't been here before. At our core, we are a community built on care, and you will see this commitment every day on campus, here at the Frank Residences, which is our new assisted living and memory care that opened in 2020, and also at the Jewish Home and Rehab Center, which is the largest private nonprofit skilled nursing facility in California. The Jewish Home offers post-acute rehabilitation, long-term skilled nursing, and a very unique 12-bed acute geriatric psychiatry unit. All told, we serve a diverse population of more than 2,500 people each year. Since our founding in 1871, our mission has been to provide older adults with comprehensive, innovative care that fosters purpose, dignity, and joy, grounded in the Jewish values of compassion, community, and excellence. This mission is woven into everyday life here. Innovative memory care programs, celebrations of diverse traditions, and the deeply personal work of guiding individuals and families through new life chapters, balancing independence with the support they need. Many of our programs are donor-funded, including today's lecture, generously sponsored by the Julian S. Davis Lectureship Fund. Thank you for your support. This is the third installment of our third annual Golden Hour Speaker Series. Dr. Theresa Allison will be talking to us today about how brain health is not defined as the absence of illness, but instead the ability to think clearly, stay connected, move confidently, and engage with purpose throughout our lives. Dr. Theresa Allison, MD, PhD, is a professor of medicine at the University of California, San Francisco, specializing in geriatrics. She holds a PhD in ethnomusicology and researches the intersection of music, dementia care, and aging. She is noted for her clinical approach she calls music medicine, using music to connect with patients, ease anxiety during routine exams, and improve the well-being of people living with dementia. Dr. Allison is the recipient of the Harris Fishbone Distinguished Professorship in Clinical Translational Research in Aging, which is a mouthful of a title. This professorship was established here in 2009 with a $2.5 million gift to UCSF from the Dr. Harris M. Fishbone Fund of Mount Zion Health Fund and SFCJL. Dr. Allison is the second holder of this distinguished professorship, which supports the development of clinical research across UCSF and SFCJL to improve the care and health of older people, especially those who receive care in skilled nursing facilities. Dr. Allison will offer a short presentation, then join our CEO, Dr. Adrian Green, in conversation, followed by a Q&A with all of you. Please join me in welcoming Dr. Theresa Allison.
Thank you. I will start by saying I have no conflicts of interest to disclose, but you should know that this drawing was done by our very own Dr. Ling-Sheng Li on the short-term rehab unit, who is actually pioneering the use of the visual arts for research analysis. Talk very, very loosely organized around what we mean by brain health, and be prepared to answer questions. I'm about to ask you this. What the modifiable risk factors are for dementia, and a shift in our perspective to make them maybe a little easier to modify. And then at the end, we're going to have a couple of examples. So I would also like you to be prepared to move a little in your chairs and to sing. And we have our fabulous Frankies here, a few of them, to help us in that endeavor. And we will grade based on enthusiasm. First question, what is brain health? So somebody says to you, what's the first thing that comes to mind when you hear the term brain health? And don't raise your hand. We have 15 minutes. Just blurt it out. Relationships. What else do you think of with brain health? Memory. Decision making. Yeah, a lot of these things. Again? Imagination, I have to add that to this slide. Hands down, creativity is what captures my soul. So like some of you said, cognition and memory are a key component of brain health, but they're not the only component. As I'm a geriatric physician, means I take care of older adults in home settings, nursing home settings, hospitals, and function is the name of the game, right? It's okay that I'm not great remembering people's names if I can still get where I want to go and do what I need to do. And as somebody else said, relationships are important, and particularly in the context of dementia. Even if I can't remember your name, I remember that I love you, right? I show it with a smile when you walk in the room. And so relationship brain health persists when the other stuff has gone away. And so does spirituality or faith. Our recently retired Rabbi Sheldon Martyr has written about this beautiful phenomenon about how in the final years and months of life, even as the body and the mind get weaker, one's sense of spirituality can grow stronger. And so today, we're going to focus on our abilities rather than disabilities, and the fact that some parts of our brain are going to keep working throughout our life process. Definitions, I promised Dr. Green I would be quick. I could spend half an hour on this slide. Quickly, do we have a pointer? I may grab the mic and dance around. Normal aging. Things come a little more slowly, right? We're full of facts. We got a lot we've got to sift through to retrieve it. So don't be surprised when you're walking down the hall and I say, hey, how's it going, Edwin? Dr. Kabigawa is behind you. Mild cognitive impairment, in contrast. This is something that people really notice, and it really bugs them. It affects one domain of cognition, often memory, but sometimes things like driving. It gets really hard to get on that highway. People start sticking to the streets, but they can still get where they want to go. And half the time, it stays stable. Dementia is totally different. Dementia happens half the time in mild cognitive impairment also. Dementia is progressive. It's a syndrome that is marked by problems with two types of memory. So I have trouble remembering names and I get lost going to the grocery store. And it's not due to another cause. It's like depression or delirium, but it is due to another medical cause. So very briefly, dementia is the set of symptoms. It's caused by many things. Alzheimer's disease is the most common. You may have heard about Lewy body or frontotemporal dementia. But that's not the point. The point is that 45% of our risk factors are modifiable. And that's what we're going to focus on for the rest of this time. And for some reason, your timer's giving me 45 minutes, so I'm going to have to do math while I do this. Normal aging. Anyways, the AARP has come up with this beautiful infographic for the 14 modifiable dementia risk factors. You can find it on their website. Briefly, physical inactivity, smoking, excessive alcohol consumption, air pollution, head injury, infrequent social contact, less education, obesity, hypertension, diabetes, depression, hearing impairment, high LDL cholesterol, and vision loss. I can never remember those. So they can be really hard to implement if we're focused on brain health. That's a lot of stuff I just rattled off. But what if we take a whole person approach? What if we remember that our brains end here? Everybody tap your fingers just for a sec to wake them up. This is where your brains end. Tap your feet a little if you can. This is where your brain ends. It's your whole body. So rather than focusing on 14 factors, let's focus on us for a little bit. Let's focus on sources of meaning, sources of joy, opportunities to learn and grow, and opportunities to engage with other people. That's what we're doing right now, right? How about we push the envelope? Everyone's wearing clothes that come down their sleeves. Put your arm on the sleeve of the person next to you, just for a sec. Just for a sec. so that we, in this 15 minutes, can actually be together in one of these activities. You can let go now. It's okay. That was just to warm you up so you're ready to sing when it's time to sing. So I'm going to cut apart the AARP material. Physical inactivity, infrequent social contact, less education. Sounds pretty depressing. What if we could do one thing that hit all of these? And that, by the way, is also evidence-based, shown to reduce hypertension or blood pressure, diabetes, and depression. Who said that? Physical activity, exactly. You can sing in a choir. You can do Tai Chi in the park. Okay, so these men who are all older than me apparently play soccer, or at least pose as actors playing soccer. I do water aerobics with my parents. And the libraries are sanctuaries in this country, right? We can go there and we're safe and we can learn and we can teach. And above all, we can be together with the ones we love and post-COVID get over our fear of touch. Oh, by the way, if we're engaged in these things, we're probably not smoking, we're probably not getting drunk, and we're in the nice clean air with the HVAC system. So we're reducing 9 factors with one thing. And why music? Well, okay, because I'm a music nerd, that's why music. But also because as dementia progresses, your music region of the brain is spared. And so this very busy slide, and now how am I going to do this without a lav mic? I can't really dance around with it, can I? Does this work? How do I turn this one off? Because you know what's going to happen if I turn it on first. Hello, 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 hello. Okay, so Jacobson, brilliant guy in Germany, got a bunch of his lab students together and played familiar music, German billboard stuff and folk songs, and identified this little area in red, which is a musical region of interest. If I were to draw a line into the middle of my head, you'd find it here. You'd also find it here. So having identified that region, he did this really clever study. He got 65 and older folks who either had dementia, Alzheimer's disease, or didn't. And he did a bunch of tests. First, they just looked at the size of the brain. This is a comparison slide. If it lights up red and green, that means the brain has shrunk in the people who have Alzheimer's. Oh gosh, look at that. Hippocampus, temporal lobe. You can't actually see the hippocampus in here. But it's shrunk, and that musical region of interest comes out at almost 0. There's no shrinking. Then they used fluoridated glucose to see, well, do you guys know that the brain eats sugar? That's like all it eats. Here, where the Alzheimer's disease effects are most prominent, you see that those cells are not eating anything. They are just sitting there. But musical region of interest, still functioning. We're not going to talk about amyloid. That's another talk. Amyloid is everywhere. We do not know what's going to happen with these new amyloid drugs, and I'm moving right along because music brings us all together. Choirs and sing-along sessions and songwriting groups and concerts are dementia-friendly. We can all participate, and it can be normal for everybody. Within institutional settings, music can have a ripple effect. I've seen this a million times in long-term care. A music therapist is in a room with a client. This is from the study, but I've seen it with activity staff, volunteers. They're making music, nurse walks by, picks up the tune, still humming when they get to the nurse's station. Another nurse thinks, ooh, that would be a good idea, turns on the radio. Next thing you know, someone's dancing. And when we add an intergenerational component, ooh, my voice got really exciting. When we add an intergenerational component, the sense of meaning really deepens. And so I love that for a long time we had a youth-focused arm of our volunteer services, and we still have a lot of youth in our volunteer services. And it's just great for the folks who live here. And I'm hoping that our older volunteers will start rejoining, because their contact also with younger volunteers is powerful for both generations. So why meaning? I've talked about meaning and meaningful activities. These are a really important source of well-being. My colleague Anna O has found that people continue to engage in meaningful activities throughout the lifespan, regardless of brain health. And in a study that I did with Alex Smith and others, we found that even when the meaningful activities change themselves, the underlying source of meaning is usually pretty stable. This is totally contradictory, right? People talk about losing someone to dementia. Not really. If you look under the surface, people are still there. And the thing I love about meaningful activities is that they support relationships and community in addition to our individual well-being. This is just a picture representation of what I was saying, that we can use one activity to hit exercise and improve physical function, music and improve mood, and in the case of behavioral disturbances and dementia, often that's unmet need. Often it's boredom or loneliness. And singing with other people, that takes care of that need, right? The social activities, and I emphasize social. Nobody there is doing a crossword puzzle. They're playing Scrabble together. That improves cognition and quality of life. And at this point, I want to transition us to a couple of immersives. The first is the PLIE program. PLIE is the preventing loss of independence through exercise. It's multimodal. It focuses on present moment, body awareness, functional movement. And now I'm going to torture you by switching mics. No, I'll do it this way. I don't know how we do this with a microphone. Oops. I want you to all try a plie exercise with me, because I find it impossible to talk about how one thing can hit muscle memory, breath and body, be non-judgmental, step by step, and have positive emotions associated. So what I want you to do is join me in an exercise. First, put your feet on the ground, nice and firm. Connect with the earth. Hello? I love your sound system. I want your sound system. Okay, feet on the ground. Bring your hands in front of you. Ooh, I get to practice squats. This is great. Instructors generally start with something like this. Let's take a deep breath together. And tap your left hand with your right, or your right hand with your left. No mistakes here. Tapping. Feel that hand on your hand. Bring it up your arm a little bit. Tapping. Tapping. Try it. It feels really good. Bring it up your arm and around your shoulder. Give your shoulder some love. It's carrying so much weight. How about you pat that neck? It's been a rough week. Bring your hand down. Tapping. 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 And if tapping is hard on your shoulders, just hold your hands together. Tapping. Go to the other arm. Tapping. Tapping. And if it's really hard, tap your legs. Tap your stomach. Can't do it wrong here. Bring it around that shoulder and back down and back down. Back down. And all of us put our hands in our lap now, and a deep breath in. Let's make it a little louder so we can warm up for singing. Can you imagine an hour of this with a skilled instructor? People get goosebumps, people laugh, people make friends, they play games. And it's evidence-based. It reduces caregiver strain and improves quality of life. And it can be done not only for people living with dementia, but also for their care partners in a dyadic group. And it can be done via Zoom. If you Google it, you'll find the for-profit version of it where you can join one. The other thing I want us to close out with is singing and songwriting. That choir that I showed you, that's a real choir. That's not actors. That's one of the Community of Voices choirs. This was a clinical trial, 12 choirs across San Francisco based in senior centers. And it was shown to improve, in addition to the quantitative stuff. I was part of the qualitative stuff because I like talking to people. We found that it improved emotional well-being and decreased loneliness, especially in our Spanish language choirs, which were quite international. We found this cultural humility. People learned the music from other nations, and they really loved that. And you can join them. Unlike most studies, when the researchers pulled out, right, the study was over, Institute on Aging and the San Francisco Community Music Center sustained them. There are 15 now. Now they're in English, Spanish, and Cantonese. And the last thing is something more unusual, which is songwriting. Does anybody here remember Judith Kate Friedman? Yeah, Judith Kate's still around. She's just up in Port Townsend, but she was our songwriter in residence for years. And our songwriters actually put out an album. If you go to the Oy Vey Cafe, there's still a few left to be bought. I saw them and I was like, what are these doing here? I might buy them all, so get one soon. Studying this, I found that songwriting actually hits on some very important things. It invokes nostalgia, which we know from the neurocognitive literature actually helps to reduce terror. It's really interesting. So if you can imagine with your brain health, if you're worried about brain health, doing something that is protective against all that anxiety, this is a great thing. Judith Kate worked with Rabbi Martyr to do a Psalms, Songs, and Stories group, and that helped invoke spirituality as they studied Psalms. But it's not just looking backwards, it's looking forwards, because at the end of the day, you have a song, right? And you can give it to people. You can give it to your family. It can be your legacy. And it's a way of giving back to the institution or engaging in reciprocity. So, y'all ready to sing? I preface this by saying I'm a flute player, and I have not warmed up my voice, nor do I care. It's about enthusiasm. So I'll sing a line, then we'll sing it together. I need a lower tessitura, but it drops a lot. Okay. You take me as, that's too high. You take me as I am. Try it with me. You take me as I am. You take me as I am. And are you ready for the surprise? Just being with you is enough for me. Can you do? Being with you is enough for me. Now we're going to do it again, but the end will change a little. We'll stay on the same note. Let's just try it together. I won't make you sing the verse. I'll serenade you. You take me as I am. You take me as I am. Just being with you is enough for me. Well, I'll tell you, this community can make somebody smile. We've got such personality, and we're learning all the while. I'm surely in good company. There's no weeping about housekeeping. I like the food here, and I'm picky, it's clear. We all like variety. Will you join me one last time? You take me as I am. You take me as I am. Just being with you is enough for me. And when I was here, the folks on our G2 unit learned to sing this, because we can learn new things, even in moderate to severe dementia. So I leave you today with some whole person questions for your own brain health. The first is, what do you love to do? I told you already I'm a flute player, right? But what gets me out and moving? Turns out it's going to libraries to play with Gail Edwards bel canto flutes. Where can I find my community? And I will tell you that 2 weeks ago, I signed back up as a volunteer because this was my community for a long time, and it's really good to be home. And I hope you'll join me. The last thing is, how can I give back in ways that feel great, right? If it stinks, you're not going to do it. But if it brings you joy and meaning, you will. And if it gets you moving, you are hitting 9 of those 14 avoidable risk factors. And with that, I have way too many people to say thank you to, and thank you particularly to all of you.
All right, can you hear us okay now that we've moved? Awesome, wonderful.
I think
That
there is
was
no better one. They're all good.
amazing, Theresa. I learned so much. Thank you. I want to circle back before we sort of talk about brain health a little bit more. I want to circle back a little bit because you have a very interesting combination of sort of pieces of your professional life, and that is that you are both a geriatrician and an ethnomusicologist. And I'm wondering if you could share with everyone a little bit about how you brought those two things together and why.
Sure. At the risk of being corrected by the other ethnomusicologist who I have heard is in the room, I study music and culture. I've been fascinated with music my whole life. I'm a little bit of an accidental doctor. You know what we say in music, don't quit your day job. I took that really seriously. So I found a day job that I really like. But it was hard to bring them together. And it actually wasn't until Jay Luxembourg took me on a tour of the Jewish home, which is what we called it then, right? That I realized there was a way to bring them together. And so I changed my dissertation topic after I had gotten through my prelims, so that I could study the music life of the Jewish home and work with older adults, learn about music and culture, and kind of bring it all together. And the big question then was, do I stay focused on nursing home as setting or dementia and relationships? And I went down the dementia path, and now it's just a thrill to bring it all together.
Yeah, and it's so fortuitous because it turns out that music is really helpful
Right.
for
So
brains.
that was my first week here. I was stopped by half a dozen people to say, I have to tell you this story. So-and-so doesn't talk all year. And then they sing, right? And every time it happens to one of us, it's so powerful.
So I don't think that we shared this enough in your introduction, but Theresa worked here for a long time, helped to open the short-term rehab unit many years ago, and then left the organization and recently came back. So has a lot of historical context and sort of institutional knowledge. And as I've been talking to you over the course of the last 6 months since you've been back, you have shared that there were a number of programs that we had in the past that have maybe gone by the wayside. And I'm wondering if there are just a couple that you want to highlight that you think we should bring back.
Am I allowed to suggest things that involve increase in staff? Because sometimes a little investment, a modest investment, makes a big difference. So we had 2 volunteer coordinators, which meant that we could dramatically increase our programs. And I understand we had 2 volunteer coordinators here for a bit. You know, everything changed in COVID, right? It's amazing how well this place has come back. A lot of folks, a lot of nursing homes are still really suffering, but I think all nursing homes can afford to invest just a little more in their volunteer staff and their activities staff because these are multiplier positions. And so it usually requires philanthropy, so I'm trying to make friends in the development office because these are not positions that you can get paid for. They require additional input, financial input from outside sources, and the programs, which is what you really wanted. Loved the songwriting program. That was a hoot. You know, you've really done an amazing job of keeping most of it. The other thing is we had art going on everywhere. So if we can take this beautiful art studio in Frank and multiply so it's available across short-term rehab, long-term care. I'm also trying to recruit researchers who are artists because, again, these things don't fall from the sky. You've got to bring in the resources. So you're all going to be hearing me, come volunteer with me, study things with me, build things with me. but you got 5 stars now. This is like awesome.
That is awesome. We're very proud of that. Can you tell us a little bit about, so the two of the things you've mentioned are the 100 years old song and the life review. Tell us a little bit about those activities.
Sure. We took the slides down, but that CD that I shared with you, Robert Butler in the 1970s made a transformative thing. It feels a little funny to the younger set now, but senility or reminiscence used to be thought of as a form of senility. It was a bad thing. Oh no, they're just, grandpa's talking about the old days. And it was Robert Butler who said, no, he's engaging in the life review. This is a late life example of Erickson's human development. When you engage in the life review, you make sense of this existence you've been living. This is a really important learning skill. And when I looked at the CD, I realized this was the life review in performance, right? There were songs about holidays, right? Hanukkah tonight. There was a song about trees for Tu B'Shvat. Then there were songs about like family outings. Turned out like a lot of these songwriters hung out at Yosemite and went to Hawaii, and they wrote songs about that. And then there were songs about their children. Esther, mein Schwester, I have a little granddaughter now. And I'm 100 years old was like the best example. They went through generations. I'm 100 years old or so, I've been told, but I don't feel my age at all. I'll live and find out what this life is all about, and I hope and I pray it's a ball. And then they had the elders speaking out the different parts. When we were 18, we had different lives. I could go on forever. You want to cut me off before I keep going?
It's amazing to me that you remember all of these
Oh yeah, I didn't
songs.
prep for
It's
this.
incredible. I think that's
No,
incredible.
actually I do. They're very catchy. They're beautiful songs. That's what I love about it, right?
I think we need to sprinkle the CD around so that people can see what we're talking about. I think that would be amazing. So one of the things that you said when we were talking about today's presentation was that people should eat and do what they love, and that will check the boxes of things important for brain health. So I love this concept because I think much of the time we eat and do what we think we need to eat and do, and that means that it's not sustainable. So we might not actually be doing the activities that are ultimately good for our physical health or our brain health. And I would say I'll use, I think in these settings, I talk about my dad a lot. He's 87. He had to hang up his tennis racket. That was very, very devastating for him.
He switched to pickleball?
He did not switch to pickleball. He now plays a lot of bridge and water volleyball, and he loves it. And I think it sort of checks off a lot of the boxes that you have mentioned. But I'm wondering if you have some other examples from your own experiences or things that you've thought through with some of your patients. As people are sort of thinking, I think people are thinking a lot about, I think about this, like what are the activities that are really going to be most helpful for my brain health over time?
Meaningful activities come in different flavors, right? There's what I want in my final months, and there's what I want now, and there's everything in between. Looking at what you really care about first helps drive it. So my mother is a teacher. She taught English, she taught Swedish, she wrote Swedish textbooks, she retired, she taught night classes, and she realized this was not enough. So she became a water aerobics instructor. And she taught water aerobics, like 8 classes a week for years until that stupid pandemic made her stay at home. And so the thing can change a lot. Tennis can become water volleyball. You can realize that the intellectual components of it translate well to something more intellectual like bridge. For me, I've gone back to flute after many years away because I just needed to grow again, but I'm not in a competitive organization. I'm not trying to get into, an orchestra. We do volunteer concerts in libraries. I'm trying to get them to consider doing a concert here. it's that giving back component. So thinking about the things that are generative, right? Whether you're giving back socially to the person you're with or to the community more broadly.
Yeah, I think that's a really nice way of looking at it, that it's not just the playing of the flute, but that what you're doing for the community.
And now I've got our junior researcher, Alex Lee, joining in the group. And it's so much fun to play with your work friend after work.
And I've heard that you play on our memory care unit with one of the CNAs, which I think is really amazing.
Yeah, he's really good. I handed him my spare student flute. He has a better sound than I do with a good flute. Man, we have some talent in this place.
So I would contrast playing flute and bridge or any of the things that you've talked about so far today with kind of the growing number of sort of app-based technology that is out there right now for sort of brain health. I've looked at a bunch of them. I've tested out a bunch of them, and I'm not super impressed yet. And I'm wondering if you can talk a little bit about how that technology compares with playing flute or singing or sitting in the art studio with some watercolors or, playing Maj or something along those lines.
Well, I think you hit on it with the social. The problem with the apps is we lose the human connection. And the pandemic was so isolating. And a geriatrician friend of mine said I had social sarcopenia, muscle wasting of my social, whatever my social was. And that's part of what motivated me to go out there and play flute, because I used to be an extrovert. Here I was at a conference all nervous. It's easy to hide behind an app. You don't have to talk to people. You don't have the brain challenge of engaging socially. So I have really mixed feelings about the apps. That said, when I was at my kids' graduation dinner with a family member with multiple family members who have dementia, it was too much for one person, and the thing that helped that person calm was actually just, heading back to the house and sitting down with an iPad. So, everyone's different. I think we need to individualize and make sure it doesn't replace the kids coming to visit or the neighbors checking in.
Yeah, I totally agree. One more question before we open things up to the audience, and it's a little bit of a divergence from what we've been talking about, and that is that when caregivers or family members have a family member who's showing some signs of cognitive decline, the anticipation of further cognitive decline can be really scary. And I'm wondering what you recommend to your patients and their families around that.
This has a lot of components. I think we know from the mindfulness literature that we need to name the emotion. And so it can be anxiety, it can be anticipation, it can be dread, it can be grief, right? That we're grieving the loss of something we had. And we don't give ourselves any credit if we still have that thing, right? So if I have a new diagnosis of Alzheimer's and I'm grieving what I'm going to lose in 5 years, it's really easy for me to dismiss that and say, well, today's a good day. I'm okay today. Instead of dismissing it, we need to name it, own it, honor it, and then figure out how to express it. Once we realize it's normal to have grief before the thing happens. This is where creative activity that gets us in the realm of nostalgia may turn out to be really important, because as we reflect back, these lights are exciting. I'm sorry, I have ADHD. I'm like, ooh, look, there's a bird. As we normalize it, right? As we go ahead and let the tears happen, then we let the emotion through us, and we can go back to a more proactive stance of finding our sources of joy.
That's great. Well, thank you so much for the conversation. And now I am certain that our audience has some questions for you. So
You don't think I
welcome.
stunned folks with that brain slide?
I think you fascinated everybody with the brain slide.
I could talk
I
about
love
that
it.
slide for an hour.
Hey, what questions do you have?
Yeah? I can hear you, and there is a microphone coming.
So I can't sing on key, and it makes it difficult to interact with people. But
They wrote a song about that here at the Jewish home. It goes, I made a mistake. Big deal. That's what
That okay?
erasers are for.
I'm getting microphone instructions. Just
no worries.
This is now
It's
perfect.
working. You're much louder.
So I wish I did have perfect pitch, but I
Oh,
don't.
yeah.
So
You and me both, brother.
I'm always a half tone
Yeah.
flat,
Yeah.
sometimes sharp.
Yeah.
But I used to play a saxophone,
Huh?
and it's sitting in my closet,
Mm.
and I look at it, and I decided to get it repaired so I can.
That is the
Try and-
first step, and it is so hard for us to do.
Oh, it was easy. It fell on my foot. So if there is a God, that's what happened. But regardless, is playing a musical instrument solo,
Mhm.
just by yourself for your own enjoyment, okay? Because I played with other people, I've taken classes, and it's been pretty stressful.
And how does it feel when it's just you?
Feels spectacular.
I think you just answered your own question.
What was it? I forgot.
No, but seriously, is it okay to play by yourself? Of course, if it brings you joy. I have a very hard time playing if it's just me. I lose attention. I get distracted. I don't take the instrument out of its case. It's having to actually get myself all the way to the rehearsal that allows me to play for 2 hours and come home so refreshed I can't go to bed. For you, it's getting rid of that stress, right? And finding your space where you can just make a beautiful noise.
I like that. Beautiful noise.
It's not original. I learned this from somebody who works at Flute World.
Regardless, it's a good thought.
It's a brilliant thought. Now that I'm using it in talks, I got to get his permission to acknowledge him.
So now I just have to find $2,000 to fix my sax.
I wasn't kidding when I said it's the biggest obstacle. It's so expensive. Remember when we could just like go to that person in that nearby town and it was like $100 and we complained about how much it was? Anyways, I digress. I'm excited that you found a source of joy. And if I can find a source of decent instrument repair at decent costs, I will try and find it. I'm here every Thursday, so I'm easy to find. Saxophone. Brilliant. See, this is why I go to people's homes and listen to them. Community. Yeah.
Question.
The brain is concerned, there's been evidence that psychedelic medicine can reconnect some of the loose connections, and it's almost like a remapping of the brain.
Uh-huh.
And I was just wondering if you
Yeah.
are aware of that.
So you're talking to somebody who keeps begging to join these studies, and people keep saying, "No, you do great on Wellbutrin. Leave it alone." I'm like, "Oh, but I could trip and feel better." There's some really interesting evidence out there, especially for depression, that doesn't respond to meds. The literature on what we used to call shrooms is quite good. The literature on ketamine is only just emerging. We don't really know what this does in terms of dementia. But you gotta wonder, right? If it's remapping our neural networks. And you also gotta wonder, do people know about eye movement desensitization reintegration, EMDR therapy? This is this therapy where your therapist is having you look in different directions as you think, and it helps you free associate. And if the psychedelics do one thing, wow, they help you free associate and break through your mental bonds. And so you got to wonder what these things could do. I guess that would be my sort of summary of it. And they still won't let me in a study. I'm going crazy.
Did you say something about the absence of willpower?
Would I say something about it? Absence of willpower in terms of behavior change, you mean?
Correct. There seems in the aging process, some people lose the will to do.
Yeah.
They retreat.
Yeah.
They regress.
So there are two different paths I could take this on. If we're talking about just behavior change, we're really talking about something that's very hard to do. I'm currently on an atomic habits kick where I'm trying to make the habit I want, make it obvious, make it easy, make it satisfying, trying to set things up because behavior change is very hard. But with aging, we run across this problem of apathy. And apathy is really tricky. We don't have a good definition of it. It can be due to depression, where you need to treat the depression. It can also be a symptom in dementia, and that can be incredibly painful for the people around them who are like, why don't you care? It can also be a problem in schizophrenia. And these are a lot of labels, right? We were actually just debating this at faculty meeting. One of our fellows presented a really interesting article on case on apathy at Journal Club, and case presentation. And we don't have great literature across the division. People were saying their inclination is to try and strike a balance. You can try things. You can try Ritalin. Sometimes it works not only in kids with ADHD, but in older adults with apathy. You can try antidepressants. You can try exercise. And then sometimes you just got to respect somebody's desire to stay in their pajamas. And it's hard.
I'm going to just add to that really quickly, as I think sometimes, we as providers contribute to what is perceived as apathy, but as we start doing more and more for people and not allowing them to use their full abilities and do things for themselves, that there's a little bit of a vicious cycle, and what might look like apathy really isn't, and we've contributed to the problem. So I think that's, one of the things we really try to do here is make sure that we are really, titrating our care so that people can, maintain as many abilities as possible.
Yeah, you're absolutely right. And we as doctors also contribute with polypharmacy. My favorite part of my job is what we call de-prescribing. It's when an older adult comes to me on 20 medications and they're feeling a little apathetic. And I say, ooh, what if we took off this one? It's a little sedating. What if we took off this one? It's a little constipating. And next thing you know, somebody is feeling better. Their stomach ache is gone. They're up and moving. So yeah, contributing to independence, reducing medications, these are important.
And
Just
we
to
have one more
final,
question. One more question over here.
Can you clarify what you
Yeah.
mean by honoring?
Sure.
Use that word.
Yeah, I use that word deliberately. It's easy for us to dismiss our emotions. I get a diagnosis of dementia when I can still keep my house clean, and I grieve the day when I'm not going to be able to do it. And I dismiss that. What's wrong with me? It's not going to happen this year. And I'm saying honor it. No, I grieve this. I see it. That grief is real. I need to feel it. I need to allow it to flow through me. If I'm stuck, I need to call the Alzheimer's Association, who have a whole new set of support groups out for folks with early diagnosis. I need to learn it's normal to grieve. Does that make sense?
Yeah, I thought you were coming at it from a different direction.
Tell me
Okay.
the direction, because maybe I can learn something.
Well, you gave some suggestions as to a person would be increasing their sociability, for example.
Yeah.
But when you say honoring, you threw me. I had
Yeah, yeah.
no, I didn't, that had a different connotation
Yeah.
to me.
I heard someone next to you use the word accepting, and I think that's maybe an easier word and one that I, thank you, could have chosen. We accept the emotion, we own it, we feel it,
What's
yeah.
next?
And then we honor our own sources of joy and meaning, run after them.
Well, I want to leave plenty of time for folks to sort of mingle and be able to speak with Dr. Allison in person. And we are so happy to have you back here. This was terrific, and we look forward to learning much, much more from you.
Thank you. It is so good to be home. And there are 4 researchers, so I'm hoping we'll get the other ones up here too.
Absolutely. Thank you so much.